Welcome to this informative video about idioventricular rhythm. We'll explore what this heart rhythm is, what causes it, how it's diagnosed, and what treatment options are available. So, let's dive in and unravel the complexities of idioventricular rhythm. Idioventricular rhythm, often described as a last-ditch effort by the heart, arises when higher pacemakers in the heart, such as the sinoatrial or atrioventricular nodes, fail to function. This failure could be due to various reasons, including severe heart disease, myocardial infarction, or heart block. Electrolyte imbalances like hyperkalemia can also suppress the normal pacemakers and allow the ventricles to take over. Certain medications or drug overdoses can also disrupt the heart's natural rhythm and cause idioventricular rhythm. Normally, the heart's electrical impulse originates in the sinoatrial node, then travels through the atria, to the AV node, and finally to the ventricles. This coordinated electrical activity ensures efficient heart muscle contraction. In idioventricular rhythm, this coordinated system fails. The ventricles, deprived of signals from the higher pacemakers, initiate their own electrical activity. This ventricular activity is usually slower and less efficient than normal heartbeats, leading to a compromised cardiac output and reduced blood flow to the body's organs and tissues. Idioventricular rhythm is not a common occurrence in individuals with healthy hearts. It's usually observed in patients with pre-existing cardiac conditions. Therefore, determining the exact prevalence or incidence is difficult, as it primarily occurs as a consequence of other underlying heart problems. Risk factors for the conditions that can lead to idioventricular rhythm, such as advanced age, history of heart disease, hypertension, and diabetes, indirectly contribute to the likelihood of developing this arrhythmia. The signs and symptoms of idioventricular rhythm can vary depending on the heart rate and the overall health of the individual. Some people might experience no symptoms at all, especially if the heart rate is close to the lower range. Others may experience dizziness, lightheadedness, or fainting spells due to reduced blood flow to the brain. Chest pain, shortness of breath, and fatigue are also common symptoms. In severe cases, it can lead to cardiac arrest. Diagnosing idioventricular rhythm involves a thorough medical evaluation. An electrocardiogram, or ECG, is the primary diagnostic tool. The ECG reveals the characteristic wide QRS complexes, slow heart rate, and the absence of P waves, which indicates that the atria are not contributing to the heart's rhythm. Additional tests, such as blood tests to check electrolyte levels and cardiac enzyme levels, and echocardiograms to assess the heart's structure and function, can help determine the underlying cause of the rhythm. While idioventricular rhythm doesn't necessarily have distinct subtypes like some other arrhythmias, it's important to differentiate it from accelerated idioventricular rhythm, or AIVR. AVR is similar but has a slightly faster heart rate, generally between 40 to 100 beats per minute. The treatment approaches may differ depending on whether it's a true idioventricular rhythm or AIVR and the stability of the patient. The treatment for idioventricular rhythm focuses on addressing the underlying cause. If it's caused by medication, the medication should be stopped. If it's related to electrolyte imbalances, those imbalances need to be corrected. In emergency situations, such as when the patient is unstable, temporary measures like intravenous medications to increase heart rate, or even external pacing, might be necessary. In some cases, a permanent pacemaker may be required to provide a stable and reliable heart rhythm. Preventing idioventricular rhythm largely revolves around managing and preventing the underlying heart conditions that can lead to it. This includes maintaining a healthy lifestyle, controlling blood pressure and cholesterol levels, managing diabetes, and avoiding excessive alcohol consumption and smoking. Regular check-ups with a healthcare provider can help detect and manage heart problems early on. The prognosis for idioventricular rhythm depends largely on the underlying cause and the overall health of the individual. If the underlying cause can be corrected, the prognosis can be favorable. However, if the rhythm is due to severe, irreversible heart disease, the prognosis may be guarded. Recent research focuses on improving our understanding of the mechanisms behind ventricular arrhythmias and developing more effective strategies for their management. Advancements in pacemaker technology and cardiac resynchronization therapy are also offering new hope for patients with severe heart conditions that can lead to idioventricular rhythm.